Sunday is Mother's Day, but it also kicks off National Women's Health Week today. Dr. Kevin Stephens from United Healthcare is joining us to discuss why women's health matters and share some tips to help support the health of women, including new and expectant mothers. Welcome back to the show, Doctor.
Well, thank you so much for having me. I really appreciate you taking out time to discuss this important topic. So thank you.
Yes, it is an important topic for sure. And I want to first ask you, why is United Healthcare so passionate about maternal health care?
Well, we insure a lot of Americans and really a lot of people across the world. And so one of our biggest things is to having a healthy population. And we really work hard to make sure that people have opportunities, we understand, and we can move the ball down the road a little bit so we all can have a healthier population, because that's what it's about.
It is so true. And I want to talk about some statistics that you all actually provided us. Listen to this, everyone. In Louisiana alone, 7.4 babies die before the age of 1 per 1,000 live births, which nearly 40 women die during pregnancy after childbirth per every 100,000. So it's definitely a problem. And I want to ask you, what are some of the causes as to why the U.S. has the highest maternal death rate among the world's developed nations?
Well, it's a very complicated answer because it's many factors. It's not just one thing. It's a lot, one of which is health disparities. We know that even in the United States, we're not a homogeneous population. So you have certain sectors of the population where you have higher mortality rates into the maternal mortality. For instance, African Americans have 4 times higher maternal mortality rates than our Caucasian sisters. We also know geographically it's located in different places. In fact, you can look at your health outcome. We can look at zip codes and tell where you have a better health outcome based on the zip code where you live. And so you look at we call them social determinants of health. You look at where you live, where you work, what you eat, your exercise, your environment. We look at the stress in your life. We look at your access to health care. We look at health literacy. All of those are factors, are very important factors. And I think we have to look at it globally to start to whittle away at this maternal mortality rate.
No, it's so true that we look at that because, reading that statistic, that is a very alarming number. And what about the pandemic? I feel like the pandemic has affected so many different things. Has it affected maternal health at all?
Oh, absolutely. I mean, the access to prenatal care because of fear of getting and spreading the virus, and actually even for the infants and so forth. So we have had a reduction in maternal visits. We have a reduction in it took a little time for us to figure out if the vaccine was safe in mothers and in children and so forth. So we had a lot of issues that just came upon us in a very short period of time. So fortunately, we're climbing out of it. And so I think this is a good time, and this is the thing to talk about today particularly.
For sure. And I think it's so important that we talk about, how to get better at this, how we can support expecting mothers, new mothers, and just maternal health overall. You have brought us some tips today. First tip you have for us is to consider vaccine options. We were talking a little bit before about how it's now good for pregnant people.
Yeah, the studies now have shown that the vaccines are very helpful to mothers, particularly when they're pregnant. And we found that it actually can spill over to some degree to infants. So it gives the infants a little extra immunity when they are born. So we know that it is definitely recommended for mothers when they're pregnant to get vaccinated unless they have some contraindication. But for most part, most 99% of the women are able to safely get the vaccine. We look at technology, for instance. There's so much information available on the internet. In fact, you can go to our website, uhc.com, and you click maternal issues, and we have a lot of information. With the computer, there are just so many places that you can go to get information. There are applications that you put on your phone that can help you manage and do kid counts and all those kind of things. So, and last but not least, we have telephones. So you can do telehealth. You can call to friends. You can talk to the doctor. Actually, look in here. I mean, your program is an excellent program that you have. And you give out a tremendous amount of information. And so that's utilizing technology to help us kick the ball down the field. So this is a very technologically advanced society today. We need to take advantage for the better health outcomes of all of us.
I completely agree. Thank you, doctor, for the compliment. There was one on there that I found very interesting. Look out for eye issues. Tell me what you mean by that.
Yeah, well, eye issues are very can be very problematic in pregnancy. Sometimes you can have blurred vision, double vision. Sometimes you can have puffy eyes, you have eyelids, and all of those are certain vision related problems because they most of the time they are temporary. And so it's good to look at your eyes. It's good to look at, as I mentioned, the puffiness, and to look and see if you have any blurred vision and those kind of things, because that could be a sign of fluid hypertension or something in pregnancy. So eyes are very unique, and we have to pay more attention to it, particularly in pregnancy.
Some great information this morning, doctor. Thank you so much for joining us this morning. If you would like more information about maternity health as well as maternal support in general, log on to uhc.com for more information. Stick with us, everyone. We'll be right back.